HIPAA and Information Technology, presented by Michelle Boyven, Christy Bowers, Tyrone Boyd, Stacy Bromley, and Angela Brown. What is HIPAA? HIPAA is the Health Insurance Portability and Accountability Act, established in 1996. The objectives of HIPAA include ensure the portability of health insurance, to prevent healthcare fraud and abuse, ensure the security and privacy of health information, enforce health information standards that will improve the efficiency of healthcare delivery, simplify the exchange of data between healthcare entities and reduce costs, and to reduce paperwork associated with processing healthcare transactions. HIPAA standards affects all aspects of health information management, including privacy and security of patient records, coding and billing, etc. HIPAA's privacy rule attempts to ensure that personal health information is properly protected. It affects all organizations and persons involved in the care being delivered. This includes hospitals, doctors' offices, home health agencies, nursing homes, instructors and students, volunteers, employers, payers, data collectors, clearinghouses, regulatory agencies, vendors, Medicare, and Medicaid. HIPAA standards continued. HIPAA affects daily clinical practice in numerous ways. Examples: clients must receive privacy notice with explanations of uses and disclosures that are clearly written. They must be notified of their rights to see and fix their health data and know who has viewed their healthcare records. Providers have to obtain written acknowledgement of HIPAA from their patients. HIPAA allows for the use or disclosure of personal health information without consent when it is required by law as per the CDC, FDA, and other agencies, or as in the following examples: audits or investigations by health oversight agencies, judicial and administrative proceedings, law enforcement purposes, as needed by funeral directors and coroners, donation and transplant of tissues, research, essential government functions such as combat, and workers' compensation. HIPAA compliance mandates that administrative and technical procedures protect privacy. Administrative procedures may include information access controls, contingency plans, formal mechanisms for processing records, security configuration, and management, etc. Technical measures may include audit controls, authorization controls, data authentication, communication, and network controls and encryption, etc. Issues with HIPAA include that it has a weakened final privacy rule. The Patriot Act and developing case law have altered expectations of privacy. The Patriot Act allows federal authorities to collect personal information on citizens for national security without notification to the parties involved. Offshore outsourced services. Foreign countries are not bound by HIPAA laws, only the United States. Data processing and medical transcriptioning occurring overseas are not bound by the law. Issues with HIPAA continued. Costs. HIPAA was supposed to reduce healthcare costs. However, costs have appeared to increase with the cost of training and implementing privacy and security. Incomplete compliance. This may be due to the small number of complaints, total number of complaints filed, no legal consequences for security violations, or that the expense is less to settle rather than comply. Privacy complaints are more visible with legal ramifications. Now let's look at some HIPAA violations. Is this an example of a HIPAA violation? Let's watch the video and see.
Ugh, that Mr. Davis has been giving me such a hard time this morning.
Oh, I know. He's super demanding. He's been asking me for seconds on desserts every single day that he's been here. Kind of smells a little bit, too. What's he in for anyway?
Well, he has kidney stones, but he's constantly complaining of cramps and pain and this and that. He also has a pretty gross inner ear infection. Kind of think he's just looking for a little bit of attention, though.
I can see that. He's a lonely old man.
I can't believe they're talking about my dad like that. I'm calling the hospital administrator.
Is this an example of a HIPAA violation? Let's watch these videos and see if they're examples of HIPAA violations.
Oh my god, Bonnie gave me this patient at 378. She's got C. diff, and I can tell she's just gonna run me all day long, and she's gonna be a bad one, I can tell.
Oh no, did you bring your nose plug?
I probably should.
I'd like 380 a place study down the hall.
Oh, I'm sure you will. I'm sure. This is taking forever. Do you want to take the stairs?
Yeah, let's just go take a stairs.
Okay.
Oh my god. What's your name? Yeah. I'm calling the hospital administrator. I can't believe they're talking about my mom in front of What was her name?
Tess?
Did you get the other one? I can't believe they were talking about that in the hallway. And they said they're
My patient in 370 is having some complaints about her care from the nurse aide, so I thought since you're the nurse manager, that I bring it to your attention.
Okay, I'll go talk to her.
Okay.
Hi, Miss Davidson. How are you doing today?
I'm good.
I'm the nurse manager, and I just wanted to come talk to you about your care you're receiving. I heard that you're having some complaints about the nurse aide.
Oh, yes, I just have some problems getting to the bathroom one time. They just don't seem to want to answer my callbacks fast enough.
Okay.
If we could fix that, I'd be very happy.
Okay, well, I will talk to them about that.
Thank you. Thank you very much.
You're welcome. Oh my gosh, Brandon, can you believe it? Miss Davidson's in the hospital and she has colon cancer. I know. I didn't even know that. But yeah, apparently she got it last week. They found out, and I don't know. I'll let you know when I find out more. They're going to do some more tests and see how she's doing. But okay, I'll let you go. Love you. Bye.
This is Mrs. Garrison. She only has about 6 weeks to live. Oh, wait.
Oh, she's okay. She's sleeping.
Okay. Yeah, she only has 6 weeks left to live, so we're just, she's in palliative care, so we're just kind of trying to make her as comfortable as possible. I gave her a last dose of morphine at 0600.
Okay.
And so, but main thing, just keep her clean after she has a bowel movement and everything. She's good.
Okay.
Miss Garrison, I heard you have 6 weeks to live. What happened to you? Well, good luck.
Oh, that's 370's call light.
Ew, discharge?
Ugh.
Or not? The answer is all the video clips were violations of HIPAA. So remember, be careful about what you say, where you say it, and who you're saying it to. On the next few slides are some hospital photos taken on the night shift. Read the caption and decide if you would consider it a HIPAA violation. This display board is found on every hospital unit by the nurse's station. It has the patient first name and last initial, along with the provider information. They are located in the hallway for everyone to see. Here is a closer look. Would you consider that display board a HIPAA violation? According to Joint Commission, it is not a HIPAA violation. The patient's last names are not found on the digital board. It would be hard to identify any person just by his or her first name. On the other hand, we have had patients not want their first names with last initials posted because unwanted guests could figure it out. Some feel this is a HIPAA violation. Where do you stand on this one? How about a central supply delivery cart with patient equipment sitting by itself in the hallway? Each piece of equipment has a tag on it with the patient's full name and room number. Would this be considered a HIPAA violation? Here we have a charting station. There is nobody at the desk. The computer is open with patient information presented on the screen. Also, there are paper forms of test results, EKG tracings, that are all left unattended. Is this a HIPAA violation? A hospital staff member cannot remember his password to log in. He asks another staff member to let him chart under her username and password. He states to her it will only take a couple minutes, so she does it to help him out. Is this an example of a HIPAA violation? The answer is all of these are HIPAA violations. Now let's take a look at 10 steps to HIPAA security compliance. 1. Understand why computer security is important. The point of computer security is to prevent personal health information from falling into the wrong hands or being inadvertently altered or destroyed. Be proactive and install computer protections that will allow you to detect and prevent trouble down the road. 2. Make certain your colleagues and staff take security as seriously as you do. Most security breaches occur when people working for the organization exercise poor judgment or fail to follow protocols in which they've been trained. 3. Catalog all the information system components that interact with protected health information in your office. Assess your office's current security risk. You have to know the capabilities and weaknesses of your information system. HIPAA requires you to carry out a risk analysis and base your new computer security policies and procedures on this analysis. 4. Prepare for disasters before they occur. An important aspect of computer security involves protecting electronic data from loss or corruption. The most important part of a contingency plan is having a backup system. At the minimum, the backup system should store all of the critical data needed to run the organization in the event of a disaster, natural or man-made. 5. Make sure your network and communications safeguards are intact and robust. Firewalls are hardware and software devices that protect an organization's network from intruders such as hackers or data thieves. 6. Be certain that you have antivirus software and keep it up to date. There is no single solution to the problem of computer viruses. Vigilance is essential. The solution to malware is installing and updating antivirus software available from specialized software companies on all of your computers. 7. Understand what encryption will do and when it is necessary. Encryption is the process of converting messages in ordinary language into a secret code form that cannot be interpreted without knowing the secret method for interpretation called the key. Here is a list of electronic data transfers and communications that should be considered for encryption. Patient billing and administrative information exchanges with payers and health plans. Utilization and case management data, including authorizations and referrals that are exchanged with payers, hospitals, and utilization management organizations. Patient health information gathered from or displayed on a website or portal. Lab and other clinical data electronically sent to and received from outside labs. And word processing files used in transcription and other kinds of patient reports that are transferred electronically. 8. Consider chains of trust and your business relationships. The HIPAA security standards require you obtain assurances from business associates that they will implement the necessary safeguards to protect the confidentiality, integrity, and availability of the electronic health information they create, maintain, or transmit on behalf of the organization. 9. Demand that your vendors fully understand the HIPAA security standards. Be certain your vendor is fully aware of the HIPAA security standards and is willing to assist you before you proceed. And finally, 10. Start with a plan and the end in mind. Start with a needs assessment, select a steering committee, develop a common vision, understand the current system, and determine system requirements, system selection, system implementation, and then maintaining the system, maintenance. Now let's look at how HIPAA affects nurses. HIPAA's effect on nurses. HIPAA was enacted to protect patient privacy and the confidentiality of health information. HIPAA protects us as consumers and reminds us of our responsibility as health care providers. A careful understanding of the details of HIPAA policy will equip nurses to recognize the gravity of unintentional disclosures without compromising exchange of vital information. HIPAA at some point will have an impact on everyone in one way or another. It affects healthcare providers by making them more aware of how personal information is stored and made available. Ways to protect confidentiality, including log off computers, shred patient information, and do not share passwords. Simplified for administration, patient confidentiality, and data security. The use of computers has become increasingly necessary for storage and transmission of patient data. This allows for speed of procedure, results of tests, and primary sources of communication. Nurses may be required to use new data gathering tools, new forms, and new programs due to the HIPAA process. Confidentiality covers all forms of communication, including the chart, the whiteboard with assignments, dietary trays, and any incoming or outgoing fax. The general rule for nurses is all information is protected unless it is for patient care purposes, such as giving report. In other words, nothing should be discussed among friends or family members regardless of how concerned they are, unless there is a release of information. Nurses should be constantly aware of data exchange that is unintentional. Turn computer screens away, log off when not in use face sheets for faxing, Do not share computer codes. Maintaining security of patient data is everyone's responsibility. Each institution has policies and procedures to refer to. HIPAA will have an effect on everyone at some point. It affects healthcare providers by making them more aware of how personal information is stored and transmitted. Finally, HIPAA summarized. The Health Insurance Portability and Accountability Act, HIPAA, is a federal mandate. One of the aspects of this legislation addresses health record privacy and confidentiality. All organizations and individuals involved in the delivery of healthcare are affected by the HIPAA standards. HIPAA sets a minimum level of protection. It does not override state laws that are more stringent in their provisions. HIPAA compliance requires a broad approach that incorporates administrative and technical procedures on an ongoing basis to ensure that patient health information is properly protected while allowing the flow of data needed to promote high-quality care. HIPAA security compliance requires vigilance. Understand why computer security is important. Make sure your colleagues, staff, and business associates take security as seriously as you do. Understanding the details of the HIPAA policy protects the consumer and reminds us of our responsibility as healthcare providers. The end. Here is a copy of references used in this presentation.